Hey Live Active community, it's Dr. Hasib Ahmed here with Live Active Primary Care. This is part 4 of 7. This is the 7 ways to improve healthcare outcomes. Today we're going to be specifically talking about making a personalized healthcare plan, why that's important, and why that improves our healthcare outcomes. All right, so let's get right into the personalized healthcare plan that every primary care physician really should be making. But again, in order to do this effectively and efficiently, you really need time with our patients. In the current model, we only have 10 to 15 minutes. Majority of the time, on average, we have 7 minutes with patients, right? And so in that time period, it's very hard to go through these steps that I'm going to outline here. So number 1, on that initial exam, we're really learning, listening to your story. Everybody has their own life story, and so you're listening. Number 2 is then you start to initiate data gathering, and so you start to get records from outside hospitals, clinics, wherever you've been. We need to get that data and review it ourselves and see for ourselves, right? And put the timeline together. And then finally we make goals, short-term goals and long-term goals. And so that's very important. And so the short-term goals help us become motivated and ultimately lead us to the big goals that could be very life-saving, right? Number 4 is we finally then monitor and identify challenges. So as we're working towards these goals, we start to identify what's difficult. So why is it hard to avoid salt in my diet? What is it? What kind of groceries am I buying? What kind of food am I taking? Maybe we educate you about using a particular fitness app or a nutrition app, and we use that data to document what kind of food you're taking in. Number 5 is then we address those challenges and then we make adjustments to our plan. Number 6 is to provide ongoing support. Everybody needs encouragement, right? And so this is where emailing, texting, the access is very important to keep the patient motivated so that they could achieve their goals. And then finally, number 7 is you ultimately do achieve your goal. So these are the 7 steps from the initial conversation, learning, to identifying, our goals, what they're going to be, and then figuring out what challenges there are to those goals, making adjustments. There's a lot of back and forth, and then ultimately leading you to goal achievement. So when developing your personalized healthcare plan, it can be summarized in 3 categories, right? Number 1 is listening to your needs, is to figuring out what your healthcare goals are, learning who is involved in your care, right? And so I call it the treatment team. Who are my team players that are involved in your care? Number 2 is to engage. Reach out to those specialists, get all the data, gather all the information, medications, imaging, labs that you've had done, discuss with your specialists and whoever else has been involved, home health care, whoever has been involved in your care, we need to engage and to learn your story, right? So first we meet you, we learn your story through your perspective, then we look at the data and we discuss with those who are involved in your care and get their perspective, right? And we put that all together. And then finally we create a customized plan, and we may order some additional testing, may order some additional imaging, but that helps you formulate a really good, strong game plan. And that's what it's about. That's why primary care is so important. And that's why relationships matter, time matters, and that's why the model of care has to allow time and allow a relationship to develop. That's why I'm not a fan of these single visits, these on-demand visits, urgent care visits. These are single visits. In those situations, no one is reaching out and getting your information, putting the whole story together. And so I strongly advise all of us to get a good primary care physician that has the time to give you the attention and the care that you need and deserve. All right, guys, that's our video for today. This is, again, part 4 of 7, creating a customized healthcare plan for you, why that's important. It improves our healthcare outcomes, improves longevity, live a stress-free life. So get out there, live active, be active in your relationships, be active in your finances, and most importantly, be active in your healthcare. So Dr. Azib Ahmed here with Live Active Primary Care. God bless. Take care. Please like our videos and write comments and subscribe to our channel. Thank you very much.